Dr. Krol is a recognized leader in children's oral health care advocacy and currently serves as Senior Program Officer at the Robert Wood Johnson Foundation. Dr. Krol, how large of a problem is inadequate oral health care for children in America today?
Unfortunately, it's a significant problem. Over 4 million children, just over 4 million children under the age of 17 have unmet dental need. So that's about 16% of children anywhere between 6 and 19 that have untreated dental disease. Unfortunately, it varies depending on how old you are and from where you come. So there are disparities in minority populations, so there are higher disease rates in minority populations, whether it's African American, Hispanic, especially Native American. Also have higher disease rates in poverty-stricken populations and children below the poverty level.
So you'd say that that is probably an underserved group, the low-income, poverty-stricken families?
Significantly underserved, unfortunately, yes.
So in your experience, do pediatricians generally take on oral health care as something within their purview, or is it considered more of an issue for a dentist to manage?
I think it depends. I think the easiest way to answer that question is that we're making progress, but there's still a long way to go. I think pediatricians recognize that there's a problem. I think they also recognize that they have a role to play. I think the challenge is understanding what they can do and what they should do.
So you just got into that a little bit, but what would you say are actually the barriers that keep them from taking a more active role?
Well, I think the three maybe most obvious barriers are what I would describe as time, money, and what's next. So I think the first barrier is trying to find the time to do the anticipatory guidance and any interventions that need to be done around oral health in the very short amount of time that we pediatricians have with our patients in the course of a day. I think that's the first challenge. I think the second is always an important one, is getting paid for the work that we do and the services that we provide. And then the third one, I think, which is a significant problem, unfortunately, is once we're able to figure out that there's a problem, what do we do next? So are we able to provide some sort of intervention like fluoride varnish? Can we find a dentist for these children and connect them to a dental home? So I really think time, money, and what's next are the three significant problems or significant barriers for pediatricians.
So that leads into the next question I had for you is really, what sort of opportunities are pediatricians presented with in their routine practice that they could really do something with?
Well, I think there's 3 or 4 of them that I'd probably point out as the simplest things to do or the missed opportunities that we have. I think the first is just asking. I think not asking is a significant missed opportunity. So what I would love to see, and I don't know that we're there yet, is for those pediatricians that have electronic health records, that there is as part of HEENT, that T is also teeth and not just throat. So I think having it as part of the routine that we do is significantly important. I think the other thing that's important and a missed opportunity is that of recognizing that oral health messages can be woven into the things that we do every day. And in fact, some of the things that we talk about already are oral health messages, but we just don't consider them as such. For example, encouraging babies to come off the bottle and onto a cup is not only an issue around obesity, but also an issue around oral health. Or nutritional conversations that we have with patients throughout the life cycle are not just issues of obesity, but also issues of oral health as far as sugar intake and frequency of sugar intake. I think another one that a missed opportunity is recognizing that we can use our whole team to address oral health issues. Most pediatricians that I know work as part of a team with a nurse or a nurse practitioner or a medical assistant or an LPN. And I think there's an opportunity for us to recognize that we as pediatricians don't have to do all of this work ourselves. And so having team members work on some of these issues and deliver these oral health messages and even apply fluoride varnish for that matter is something that I think is a missed opportunity. And then the final one I think that's extremely important is recognizing who else in our community can provide oral health services to patients. And most specifically, which dentists in our community will see our patients. And I think that's the most challenging, that is our patients who are on Medicaid, is recognizing and understanding and knowing which of our dentists are able to see those patients, able and willing to see those patients. So I think if we can address some of those missed opportunities, I think we'll do well by our children.
So let's switch gears a little bit and talk on, a higher level. So right now, healthcare reform is really top of mind for patients and physicians alike. So are you optimistic that healthcare reform will positively affect patients receiving oral health care?
I'm cautiously optimistic. It's sort of a good news and bad news thing, and as you know, there are so many things going on right now as far as how the ACA will play out in its implementation. But the good news and bad news is, the good news is that the pediatric dental benefit has to be at least offered in the exchanges as well as any individual or private insurance marketplaces. The bad news is that, at least in the federal, and I believe even on the state, patients don't have to purchase it. So it can be offered, but it doesn't have to be purchased. And if it's not purchased, then one significant barrier for patients having insurance, having dental insurance, is there. And I think that's a missed opportunity, and something that I know a lot of my colleagues in the oral health world are lamenting, that it's not part of it's part of the benefit package, but it doesn't necessarily have to be purchased in the federal exchange. So I think that's, for the most part, that's why I'm cautiously optimistic. Ideally, if everything works out as it could and should, and if everybody purchases that dental insurance, I think we can see over 8 million kids who didn't have dental insurance before having dental insurance, which I think is a wonderful thing. That's the ideal, and unfortunately I think we'll be somewhat short of that.
So do you think that the issue surrounding insufficient oral health care for children is receiving sufficient attention and funding right now?
Well, I'm biased, so the answer for both is no. I don't think it's receiving enough attention or funding. And I think if we think a little bit about it, it's, besides my bias, I think it's true. First, one only has to look at the conversations around health and take a closer look and see, when we're having conversations about health, how often dental comes up in the conversation. Often we talk about the uninsured. We're really talking, or those without health insurance. What we really need is people without medical insurance, and we don't really talk about the individuals who have dental insurance. So there are a lot of people that have medical insurance and thus are considered insured that really are underinsured without having dental insurance. So I think that's one issue. The other thing is, we just have another sign of not having enough funding, is the fact that the amount of money that's spent on dental in our Medicaid budgets is very minimal. The amount that's spent in the larger funding streams within the NIH, for example, focused on dental, is very small. So in the grand scheme of things, unfortunately, dental plays a very small role. And even in our day-to-day conversations around health care and health insurance, dental is often forgotten.
So what steps could a community-based pediatrician take today to better advocate for and ensure that the oral health care needs of their patients are being met?
Well, I think there's a number of things. I think the first is just educating oneself about oral health, around recognizing who's at risk for dental disease, recognizing and understanding what kinds of things can be done to prevent dental disease, and understanding how and when to refer people, or specifically children in this case, for dental disease. I think advocating for dental benefits is extremely important, and in that context, advocating for adequate and appropriate payment for services, dental services and medical services for that matter, within Medicaid, I think is extremely important. I think just addressing it at every visit in some way, even if it's couched in a nutrition conversation, just bringing up the fact that there are also oral health benefits to having appropriate nutrition and not sucking on a sippy cup all day long full of the blue sugary juice, or things like that, I think are extremely important. And then I think the other thing that we can do, that community-based pediatricians can do, is actively refer when there's a problem. And I say actively refer because I think at times, and I've been guilty of this in the past, is that probably the easiest and the least active referral is you have a dental problem, you need to go see a dentist. One could consider that a referral. We've suggested that the patient go see a dentist. A more active one might be you need to go see the dentist, and here's a list of dentists that you could call. Another one might be what I often do with patients who I hear a murmur in, is I will write a note to the cardiologist and say, either give that to the patient or contact the cardiologist and say, I hear this murmur, I think there's a problem here, I'd like you to evaluate this patient. I think there's an opportunity for us as pediatricians to have conversations with our dental colleagues in much the same way, where I have a patient, I need you to see this child because I think there's a problem, and making it a more active referral. Takes a little bit more work, but again, if we're working as a team, which we often do with our referrals in any other situation, whether it's a murmur or a cough that we can't seem to figure out what's going on, or some other significant problem where we have to contact our specialist colleagues, I think there's an opportunity for us to do that with our dental colleagues as well. And it's just a matter of having the conversations and knowing those people in our community who are providing those services.
Well, thank you so much, Dr. Krol, for being part of this conversation. This has been Dr. Crystal Murcia for Contemporary Pediatrics.